So good evening, my dear doctors. Today's topic is learning and memory as well as long-term potentiation. So this topic is not only important for the medicos, but we must know that learning and memory as a student, we all want to learn something and we want to strengthen our memory from short-term memory to long-term memory. So a lot of things are there in the physiology of this. And this is asked in your MBBS exam either as a short note or MCQ. Okay. Sometimes they can be asking you this topic in as a part of the long question. Like they can ask you different type of aphasia, and in that they can ask you what do you mean by learning and types of memory and how short-term memory converts into long-term memory. Okay. So although this is a short topic, but it's very important nowadays. So first of all, you must know the difference between learning and memory. Okay. Whatever I am discussing here, what do you think? It is a learning or a memory? So acquisition of new information or a skill. Okay. So whenever you are acquiring any new information or any skill, it is called as learning. So learning is actually acquisition. It is a knowledge or a skill you are acquiring. It is an acquisition of either new information or skill. You want to drive a car or you want to drive a bicycle or whatever, you want to do some surgery, you are learning that. So these are learning. And once these are stored, storage, storage of this information or the skill is called as memory. So in one word, okay, so sometimes they ask in the Viva also, doctor, tell me what is learning and what is memory. So remember, it's very good evening, Dr. Amul. Learning is acquisition of new information or the skill. Whenever you are acquiring any new information or skill, it is called as learning. And when it is stored, there's a process, I will discuss that. Through that process, that will be stored and it is called as memory. Now, we have heard that there are two brains. Initially, we say right brain as non-dominant, left as dominant. But right now, we are not using the word dominant or non-dominant. We are using R for right and R for representational. Right brain is representational brain. Okay. And left brain is L for left, L for logic. Logic. So when you are thinking logically, like mathematics, like speech, language, okay, you are doing some calculus problem, some physics problem. So when you are doing some mathematics, or you are doing some logic work, psychiatry, okay, so all those will come in the left brain. On the other hand, right brain is like a intuition based thinking, like art, music, and dance. So art, music, dancing, these all are learned by mainly representational side of the brain. So don't think that right brain is non-dominant, left brain is more dominant. No. Now we say both are important, but the type of things are different. So right brain is also for spatial memory. Your memory become three-dimensional. For example, some people are reading and they got only by one vision they can understand. They can reproduce the same topic again and again. They can write. Okay. But sometimes we are reading the same topic again and again and we cannot answer the question. What is the reason? They are they are using their artistic brain. They are using their artistic brain, the right brain, to develop their three-dimensional memory. So when you involve emotion, see, memory can be increased only by two methods. I will discuss both. One is emotion, other is repetition, the revision. So when you involve your, for example, you are attending the class and you're very emotional that today I will understand each and every point and I will acquire this in increasing my memory. Okay. So your each and every word will be clear to you. It all depends on your emotion. Okay. So right brain is important for which type of memory? Spatial memory, three-dimensional memory. On the other hand, left brain is logical. You are understanding the lecture because of the logic. Left brain is involved. The language, you know the English, my speech, okay, some mathematics. But how much you will remember, it all depends on how much emotional you are. So right brain is representational art, music, dance, and left is what? Sometimes you remember the lyrics of some song which you like. But when you are reading the Ganong or Gaitan, you forget the first line because you are emotional about that lyrics of the song, isn't it? So this is the right brain. So try to utilize right brain along with the left brain. Don't always read like books like that. Try to understand. Try to build an image. And when you are building the image, automatically things start coming to your hippocampus and short-term memory will convert into long-term memory. Now, if there's a lesion of right side of the brain, there will be hemispatial neglect and stereognosis. What is hemispatial neglect? Okay, in these conditions, you will see that patients are taking care of half side of the brain or the body. They will wear some shirt on the half side. They will shave their beard on the half side. They will comb their hair on the half side. So what is that called as hemispatial neglect. It is one of the question in your MBBS. They ask hemispatial neglect is due to lesion of which side of the brain? Answer was right side. On the other hand, left side lesion will cause different type of aphasia. It can be Broca's aphasia. Next time I can take type of aphasia. Next Tuesday I will take topic of different types of aphasia. Wernicke's aphasia, and there are so many anomic aphasia, conduction aphasia. I will discuss in next class. So when there is a lesion of the left side of the brain, it can cause aphasias and the lesion of right will cause hemispatial neglect or stereognosis. Now, types of memory. Memory are of two types. One is declarative, other is non-declarative. The first coming to declarative memory or explicit memory. So this is in your consciousness. Suppose that I am asking what is your name. This is in your consciousness. What is your name? Okay, it is a declare. You can declare your name because that your name is in your consciousness. Okay, what is your age? What is the name of medical college you are studying in? Okay, so like that, the memory which you can declare is called as declarative memory or explicit memory. Okay, and these are of two types: semantic and episodic. Semantic means factual, like name, place, which place you are studying, or some person, okay, who is studying in front of you, or you are sitting watching the lecture along with whom. So the person, name, age, what is your age? These all are called as semantic, factual. Episodic, the events, like how was your first day in the medical college? How was the first day in your medical college? Okay, is it good, bad, whatever? So that is your event. That is called as episodic memory. So that is the event. How was, like for example, how was your first day in college? Okay, it is called as episodic memory. This is clear. So in declarative, there are two types: semantic and there is episodic. Semantic is factual, episodic is event based. Now, what are the part of the brain where these facts are accumulated? Like for example, what is your name? You remember this. Why? Your lateral and anterior temporal cortex is involved. Lateral, because medial is busy with the event. Who's closer to your heart? Event or the name? Events, na? How was your day? All the events, all the memories. These are medial to your heart. So remember like that. Medial temporal. Medial. Just remember only one, temporal lobe. Temporal lobe. Which lobe is involved for declarative memory? Temporal lobe. Okay. Which is for events, medial. Which is for fact, lateral. Lateral. Although prefrontal cortex are also there, hippocampus is also there, but at least remember temporal cortex. Medial is for episode, the memory, the event part. How was your first day? How was your today? How's your weather? Are you enjoying your college or not? How was your evening? So all those events, Okay, you are celebrating the birthday of your colleagues. Okay, how was that event, or your fresher party? So whatever those events, these are called as episodic memory. So in the declarative, episodic memory and semantic memory. So episodic memory. Okay, so remember your fresher party. What is that? Episodic. And you are dancing with your one of your friend. What was his name or her name, whatever? Semantic memory. So when there is some name, okay, place. You are dancing in which area? You are from which area? UP, Maharashtra, wherever. So that is what? Semantic. So please, this is the gist of the exam question they will going to ask you. Now, first is declarative memory, and second will be non-declarative memory. Declarative memory is called as explicit. This is called as implicit. Implicit. This is the most common category of types of memory given in Ganong, which they ask in the examination. Declarative memory and non-declarative memory. So declarative is for what? Semantic, episodic, events, facts. Implicit memory, non. This is what? It is in your subconscious. Those memories which are not in your conscious, but in the subconscious. Like if I ask you, can you drive a car or not? Or can you drive a bike or not? Yes or no? You can say, sir, I cannot say. I will drive and I will show you. You can show me how to drive a car. Or for example, you are a surgeon and I'm asking you, can you do lap chole surgery, laparoscopic cholecystectomy surgery? You can say, I can show you. I know the how to do the surgery. So those procedures, okay, those things are in your subconscious memory, which you cannot say, you cannot declare, but you can show. So when you can show, the showing of the act is called as non-declarative. Remember, that was declarative. This is non-declarative. That was explicit. This is implicit. Explicit memory, implicit memory. Clear? That was declarative. This is non-declarative. Now there are four different types, and all are itself a short note. They can ask a short note on priming, procedural memory, or the priming, or associative, or they can ask about the non. So they itself are subtopics. So what is the procedural memory? Suppose that you learned how to drive a car or how to do a surgery. So whenever you are learning some procedure, some method, in your first year, you know how to prepare a peripheral blood smear. Okay, a procedure is there. Okay, you are using microscope, or how to do TLC. You are using some chamber, Newbar chambers. So that procedure you will learn by repeating again and again, and that is called as procedural memory. Skill, habits. And remember, the first part of the brain is most important. Who is involved? Corpus striatum. And please tell me, corpus striatum is the part of, answer is basal ganglion. Basal. So either you can say procedural memory is because of the basal ganglion, or you can say it is because of corpus striatum, because corpus striatum is the part of basal ganglion. Even if you don't remember the cerebellum and motor cortex, just remember the first one, corpus striatum. If you can remember all of them, it is good. Second, and the most important, is priming and perceptual neocortex. What is priming? Okay, let me ask you. I am going to write name of a city. Tell me which city is that. Tell me which city is that. Can anyone tell me which city I am going to write? Dash, 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 dash. Or other city, dash, 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 dash. Or I am going to write a name of some book. Okay, tell me which book is that. Now, those who already know about Lucknow, they will tell you this is Lucknow. They can tell this is Delhi, and you can say this is Gaitan. Okay. This is called as priming. Only if you know something and I'm giving you a hint. Okay, what is that called as? It is called as priming. There was a question MCQ asked in your examination. Question was like that: who discovered EEG? A examiner asked a student who discovered EEG, and he was not able to answer. He forgot somehow. He was not able to answer who discovered EEG. Then suddenly examiner has given a hint. It has something to do with MACD. Then he said, okay, sir, it is Hans Burger. Then question was, which type of memory it is called as? And answer was priming. Answer was priming. So when someone is giving you a hint like that, correlating, it is called as priming and perceptual. And the part of the brain that is involved is called as neocortex. It is called as neocortex. Now, next is associative learning and non-associative learning. It is very important, a separate MCQ and short note in your exam. Associative learning are of two types. One is your Pavlov experiment. You know classical conditioning done by Pavlov, classical conditioning. And second is operant conditioning. Second is operant. First of all, what is associative learning? Suppose you are going outside to have tea or coffee and you are seeing the clouds. You can say today it can rain. So just by looking at the cloud, just by looking at the cloud, you are saying today there can be a rain. You have built association because from your past experiences, you have seen that whenever there is cloud, automatically there is always a rain most of the time. So you are associating something. It is called as associative learning. Clear? And there are two types: classical conditioning and operant conditioning. Regarding classical conditioning, you must have read in your intermediate also Pavlov experiment on the dog. Do you remember? Dog Pavlov experiment. Suppose that if you are giving food to the dog, if you are giving food to the dog and dog is salivating, is it a classical conditioning or an innate reflex? What do you think? If अगर आप खाना दे रहे हो एक डॉग को and dog is salivating, is it normal? So it should be called as simply innate reflex. It should be called as simply innate reflex. Yes or no? But one day, at the same time, at the same time, you will suppose that every day you are giving food at 1 p.m. Every day. And along with the food, you are also ringing the bell. You are also ringing the bell. So dog is associated that whenever you will ring the bell, you will give the food. One fine day, you are only ringing the bell. One fine day, you are only ringing the bell, and even without food, this is important, even without food, dog started salivating. What is this called as? This is called as classical conditioning. This is actually called as classical conditioning. So we all are living reflexly. For example, every day you are going in your hostel 6 p.m. tea time. Okay. So reflexively at 6 p.m. you start developing craving for some tea. Or every day you are talking to your home, to your parents. Okay. You're talking to your parents at 7 p.m. automatically you will get a reflex that I should talk. So whatever you are doing every day, automatically at that time that reflex will be built. इसको हम आदत बोलते हैं, हैबिट फॉर्मिंग. इट इज लाइक अ हैबिट. Okay, those who are smoking, even they don't remember as they go out and start smoking the cigarette, without even being aware. Because every day they have a habit of, whenever they are going out with the bike, their bike will go to the some cigarette shop. Okay. So automatically, without thinking that they have to smoke, they will go to the shop. So these types of things are actually because of the reflex build, and that is called as classical conditioning. So we are living life reflexly only. That is why they say, na, always try to build a good habit. Suppose every time you are sleeping at 10 p.m. and waking at 5, every day you wake up at 5 a.m. It is all because of the classical conditioning. Okay, or else nowadays you are sleeping at 3 a.m. and waking at 9, bunking the class. So that is again become a reflex. Okay, and chronically we become absentee. We are not going to the class. And this is all the reflex, the habit which we are forming. So life is all about the habits. If they are good habit, automatically every day you keep on improving your life. See, discipline, why? This is about the discipline. If discipline is built by you are the master. And if someone else is building discipline in you, you are a slave. If teacher have to say you have to come on time, it means that you are obeying him, but that is a different thing. But you are self-disciplined. It is a different thing. You are a master of your own habit. So this is your classical conditioning. Second is your operant conditioning. Operant conditioning. It is based on punishment and the reward. It is based on punishment and the reward. Actually, there was a scientist. Okay, he put few monkeys in a case. Few monkeys were in the case, and there were two handles, handle A and handle B. Whenever they are hitting handle A, they got a banana. They got a banana. What they get? A banana. And whenever they are hitting handle B, that handle will be hit on the head. They will get punished. So eventually, all of them starting hitting A. So A will increase and B hitting will decrease. So when we start giving some punishment, or suppose you are driving without helmet, and because of some unfortunate accident and there is some injury over there, next time you will not forget to wear helmet. It is a punishment based learning. Or the reward, suppose you are in your anatomy class or physiology class and teacher is complimenting you that you are working very good, your answers are very nice, you're studying very hard, so you start getting the reward and you start increasing the act. Okay, so once you start getting the compliments, you start increasing the activity. And once you start getting the punishment, you start decreasing the activity. So this type of learning is called as operant conditioning. That was classical conditioning and it's called as operant conditioning. So third was associative learning, classical and operant. Next is non-associative learning. And this comprises of two things, habituation and sensitization. So there are two non-associative things. One is called as, after the class, you can just uh, please revise this topic again and again for 3 4 times. Even you can increase the speed and see this video again and again, so that can be in your salkai and galai of your brain. This is important topic. So one is your habituation. One is called as habituation. Other is called as sensitization. Suppose your room partner is very nagging. He is fickle mind. Suppose that you got room partner, but he is having a fickle mind and he's very nagging. But you are very intelligent. Okay, you start adjusting to that situation. It means you are habituated. You decrease your response. You start decreasing the response to his stimulus. Okay, on the other hand, suppose that after 1 month you are going to your warden, sir, I cannot live without him. No, I cannot live with him, not without him. It is a different act. So what is that? You are sensitized. Now you become very sensitive for every activity of him. So your response is increased. So like that, for example, today 6 p.m. there is a class. At the same time, there is some match going on. Okay. And you are very sensitive for your study. You want to learn something. So those students who want to learn, they will be attending the class and seeing the lecture. On the same times, your mind might be freaking. I can see some reel on Instagram or see some YouTube channel, some song and all. So when you are habituated कि पढ़ के क्या होगा पढ़ते रहते हैं so you will not be very serious about that. Your response will decrease. Yes, hello Tinu. Okay, so when you are habituated means for the same stimulus your response is decreased. When you joined your medical college, first day, okay, teacher will ask you why you want to become doctor. I want to serve the society, this and that. I want to attend every class, I want to learn like this, I want to become a scientist also. But after 1 month, second month, third month, fourth month, fifth month, what started happening? Okay, response started coming down. It means you got habituated. When we are preparing for NEET UG, all of you are very much sensitized. I want to become a doctor, this and that. So when your responses increase for the same stimulus, that is called as sensitization. Clear? So this is a brief about types of memory, declarative and non-declarative. Okay? After the class also you can just see once again and you will remember that. Now the most important thing, long-term potentiation. How short-term memory, how short-term memory converts into long-term memory. What is this process called as? And where it is happening? It is happening in the hippocampus. Everyone wants a long-term memory. Okay. So where it is happening? Hippocampus. In which neuron? CA1. Okay. And this is a process of long-term potentiation. Which neurotransmitter is involved? What is the answer? Glutamate. Which neurotransmitter is involved for conversion of short-term memory into long-term memory? Glutamate. And there are two receptors. One is called as NMDA receptor. Other is called as AMPA receptor. Other is called as AMPA receptor. AMPA. NMDA and AMPA. Now, NMDA is blocked by a ion. Do you remember which ion? Magnesium ion. Magnesium ion. Now, I am going to ask you, when glutamate is released, what do you think? This is going to stimulate NMDA or AMPA? You know NMDA is more important, but it will stimulate AMPA so that there will be influx of sodium ion. And this influx of sodium ion will generate excitatory post-synaptic potential that will remove the blockade of magnesium. Remove the blockade of magnesium. Clear? So when glutamate is released, suppose you are revising for first time. So action potential will come like that. And this will open voltage gated calcium channel. This will cause exocytosis of glutamate. And this glutamate will attach to the AMPA, cause influx of sodium, generates EPSP, excitatory post-synaptic potential. This will remove the blockade of magnesium. Now, this glutamate will activate NMDA so that now calcium will come inside. Calcium will come inside. And this calcium will activate nitric oxide to cause retrograde. It will cause retrograde synaptic enhancement. Okay. So strength will increase. Synaptic strength will increase. So every time you are revising the notes, or you are studying something, or you are doing something, every time strength will be increase. This is how the revision. Instead of reading two books, read one book twice. Because when you start revising, what is happening? Strengthening of the synapse. What is memory? What is memory? Strengthening of the synapse. Strengthening of the synapse. So once again, suppose you are revising for the first time. You are doing any activity. Action potential will come, cause influx of calcium. Calcium causes exocytosis of the synaptic vesicle. Glutamate will be released. This will activate AMPA, influx of sodium, generation of EPSP, removal of magnesium blockade, influx of calcium, activation of nitric oxide, and retrograde synaptic enhancement. So this again can come as a short note, but very important for MCQs which are asked in your examination. So this is in brief about types of memory, okay, declarative and non-declarative, as well as how short-term memory convert into long-term memory in the hippocampus. So this is it for today's class. Next time, next Tuesday, okay, we will discuss about the type of aphasia, like Broca's aphasia, Wernicke's aphasia. So all those will be discussed next time. Till then, bye bye, take care, all the best, study hard, enjoy your life. Bye bye.